Welcome back, guys. Today I'm gonna talk more about sexual transmitted infection, and I put more focus on gonorrhea. Now, thank you for the support. Subscribe to my YouTube channel, like, share, and comment to get more of my health videos. Now, gonorrhea or gonorrhea is one of the sexual transmitted infection that is caused by a bacteria known as Nesseria gonorrhea that is transmitted through what we call sexual intercourse. If you have the vaginal sex, the oral sex, or the anal sex, or just sharing the sex toys with the infected person, that you're gonna contract this gonorrhea. Now, gonorrhea is very common. Is the second sexually transmitted infection that is more common in teens and young adults. However, it can affect each and everybody. Now, what are the risk factors for this gonorrhea? Number one, if you are sexually active, you are at risk. You are prone to these infections. Now, the other thing is if you have multiple partners, you are also at risk of contracting this gonorrhea. The other thing is that if you practice the unprotected sex with the infected person, you are also at risk. Now, the other thing is if you practice the anal sex, the what we call the male homosexuality, you are also at risk of getting this gonorrhea. Now, what are the signs and symptoms? If you contract now this gonorrhea, which is a sexually transmitted infection, what are the signs and symptoms? Remember, it affects both men and women. Now, most likely, it can be asymptomatic, but however, it can present like in men with a history of what we call white penile discharge. There's a discharge coming from the penis. The other thing is pain during urination. The other thing is what we call testicular pain and swellings. So those are some of the signs and symptoms that the men gonna present with. Now, on women, it's gonna present with white or increased white vaginal discharge, that is subdualis, very bad smell. Now, the other thing is what we call urination, pain on urination, or there is a panning cessation during urination. Also, they can have peripheric pain. They can also present with lower abdominal pain and also pain during sexual intercourse. There's pain during sexual intercourse. So these are some of the signs and symptoms that once women contract this gonorrhea, they're gonna present with. However, if there is a practice of the anal sex and also the oral sex, they also present with infections on the throat and also the anal region. Now, what are the investigation that the doctor gonna send you to do if you have come with these symptoms or signs and symptoms? Number one, the doctor gonna send you for the urinalysis for microscopy and culture to rule out other investigations, other infections. I mean, now the other thing is to do the sexually transmitted screening to rule out other what we call the sexually transmitted infections, such as what we call the syphilis and the chlamydia. The other thing is the urethra swab for microscopy and culture. This is for men. The other thing is what we call the cervical swab for microscopy and culture for women. Now, the other thing is what we call the peripheric ultrasound, if it's required. If you present, like now in women, if they present with what we call the peripheric pain. Now, those are some of the investigations that the doctor might send you to do so that to confirm more on this gonorrhea. Now, the other thing is how are we going to treat this? How are you going to get treated if you contract now this one? You have done the investigations and the report is that you have gonorrhea. Now, you need to know that this is a sexually transmitted infection. However, it's curable if you take the medication, the required dose, and also you be compliant and you adhere to the medication. Number one, you're gonna be given these painkillers, because this you must have pain, so you need analgesic to just relieve you from pain. Now, the other thing you're gonna be given is the antibiotic. They can just range from the injectable antibiotic to what we call the oral antibiotics. Now, if you take the course as is prescribed by the doctor, you're gonna get well. Now, the other thing is you need to treat your partner so that you can get rid of this sexually transmitted infection in your family or in the partner. Now, the other thing we need to know is how we prevent, because we need to prevent this sexually transmitted infection. Number one, we need to always wear just a condom, always use a condom so that you can prevent yourself from contacting this other sexually transmitted infection. Remember, not only gonorrhea, which is a sexually transmitted infection, there are other sexually transmitted infections now, such as syphilis, chlamydia, HIV, and all other genital warts. Now, the other thing is that you just have one partner so that you can, reduce the risk of contracting this sexually transmitted infection. Now, the other thing is that you need to practice what we call safe sex so that you can reduce the risk of contracting this sexually transmitted infection. The other thing is that you need to abstain also so that you can avoid getting this sexually transmitted infection such as gonorrhea. Now, remember, this if goes untreated, it's gonna cause some complications. Like in women, they can present with what we call the peripheric inflammatory disease. This is due to the bacterial migration to the reproductive system. Now, it's gonna bring some complications that causes the peripheric to pain. Also, it can cause what we call the infertility in men and women if it goes untreated. The other thing is it's gonna cause if a woman who is pregnant contracted this gonorrhea, it's gonna cause some preterm what we call birth. This leads to what we call predisposes the baby to just a preterm birth. So it's better to get treated if you have the signs and symptoms and you doubt that this is what we call gonorrhea. So you need to go and get treatment. You need to go for the checkup. Now, I'm gonna do other sexually transmitted infection video in my next video. So stay tuned, subscribe, like, share, and comment to get more of my videos. Thank you.